Okay, so just let's go quickly through this dealing with difficult. Sorry, I will share dealing with patient with learning difficulties because it came in Blab 2 in 3 stations. Two station are very obvious. That's there is like they wrote in the task, special note, this patient has learning difficulty. But the third station, which no one knows it, but it seemed to be as learning difficulties as well. It was about autism. The mother, her child has autism, like autism follow-up. The patient already diagnosed with autism. But the mother, like, she kept telling the doctors, like, two of my doctors had the exam, and she was saying the same. She telling them, I can't hear you. Can you repeat? So if she kept doing this, and they told me there is something wrong with the GMC line, telephone line. No, I told them it can't be true. They can't make something like this in the GMC, but it's because other patient can hear you. Why just only one patient can't hear you? They just try to make it as dealing with a patient with learning difficulty. Maybe she has a hearing problem, or she might has any other difficulties. She need you to speak slowly, or yeah. But whatever, like the role player tell you anything, take it seriously. They try to check you in some area, or try to the role player itself trying to guide you to some important point. So in Blab 2, there is no trick, and everything they say to you, it's related to your station. Every single sentence. There is never any distraction in Blab 2. It meant to be very easy, like very straightforward. Like since the patient telling you the first line, you will know what the station is. So it meant to be easy, but the whatever they telling you, don't ignore it. I think like I'm doing this station, for example, I'm not going to waste time in smoking if the patient brought the question by himself. So if they brought anything, because when you ask open question, anything else, do you want to add anything? Once you ask, they can tell you something and you are not expecting it in the station because you was prepared for something different. It's for a reason. They change the station, there is something they're checking you out in it. So whenever the patient tell you, don't ignore it. Never ever ignore it. Because in Blab 2, there is no any trick. If, for example, if they told you I have family history of cancer, it means the station about cancer. So there is no trick in Blab 2. There's always something for what they say. And it has to be straightforward. You don't need to see too much. It's very like very obvious things. Yeah, whatever they say. So let's see, dealing general just approach about dealing with patients with learning difficulties. So in general, like just general tips to consider. Make sure the individual is comfortable. So we know in Blab 2 is not just patient with learning difficulties. Any patient, we need to check for comfort. Like even you see them in pain, ask them, are you comfortable to talk or not? But here, it's not just about pain, it's about even they can be frightened by you. If he had, for example, mental issues, they will be very frightened from strangers. So they need to make sure you are not enemy for them because their thinking is very limited. They may not know even you are a doctor. So try to make some effort to make sure they are comfortable to you. And in Blab 2 station, the patient has mild learning difficulties. So even it didn't need all this, but just with this, they may change the station. They may make the patient with severe disability. So we never know, because this is very common in this country. People with learning problems, with learning difficulties. They don't say disability because it's negative word, so please don't say it. But yeah, there is some people very disabled and they can be your patients. So you need to know how to deal with them. So make sure, sorry, please mute yourself because the echo might consider a family member or someone who is familiar to the patient to be present. And this is for two reasons, like to give them kind of security, like because they just feel comfortable with them, they get used to them. And also you may need to involve those people in management plan. So That's why it's really important to be a family member, to be present, and try to find a quiet spot, minimize distractions, try to establish a positive relationship with the patient, as I said, because they are frightened and have some issues, so you need to build a rapport with them. It's really important, especially in this station. In all blood station we do that, but in this station it's really important. The first line, don't miss it. Reassure them and be very kind to them. Explain the consultation before starting. Use open questions, then paraphrase and check again. Find ways to communicate effectively. Use simple words. Speak slowly. Do not shout and pause. So do not shout. Like, for example, if the patient tells you, I have hearing difficulties, don't assume they can't hear and start shouting at them. So start from low, normal tone and increase it gradually until they tell you, I can hear you. That's fine. So continue with the volume they said they fine with it, because it will be very annoying if the patient can hear you and you speaking very loudly. Just you make them feel little and you shouting at them. So because sometimes they have hearing aid, whatever, so you need to elaborate the disability in details to find out what exactly can do and what they cannot do. Do not overload the individual with too much information, so speak in short sentences and check understanding again and again. Use visual to help as well, drawing, gestures, praise them, use positive language, as I said, in all blood station to get more IBS. You need to make the patient feel positive about themselves and praise them for anything, even something not really very great, but make them feel great. Like, thank you so much, as I said, for bringing your child, her own child, but still we thank her for bringing him to the A&E. You did very great job and well done. We appreciate it. Always use positive language. Be sensitive to the individual nonverbal cues and adjust your behavior accordingly. So I said, because people with learning difficulties, they can be frightened, so they can shrink back from you. So just keep space between you and them. If you felt they frightened from you, and try to smile back at them. So what the games, he said, according to people with learning difficulties, they said patients need relevant information to be shared in a way they can understand and retain, so they can use it to make their decision. So any patient, regardless their mental ability, they have the right to make their own decision unless they can't. And we don't know unless we tested them. So, and unless we even help them to understand what we're saying to them. So always make sure when you speak to people with learning difficulty, this is applied for everyone, but it has to be in every consultation with patient with learning difficulties. We know, for example, patient who refuse medical treatment or procedure, so we need to check their mental capacity, so we apply same this stuff. But any patient with learning difficulties, we need to check these things to say that they have learning difficulty. We can't just assume. So we need to help them to the maximum, like even if it still seem to be have mental issue, very obvious for you, help them to understand, draw down for them pictures and this, make effort to help them to decide for themselves if they want this or they don't want. If they turn out they lack in mental capacity, in this case you can do what in their best interest. Otherwise, try to help them and respect their humanity. Don't assume they are lacking mental capacity. So so we need to, like, as I said, we need to share this information in a way that they can understand. So use simple language, speak slowly. And to help patients understand and retain relevant information, you should share it in a place and time when they are most likely to understand it. So the right place and right time is also important. So if you think they are not in good mood, you can delay the consultation for other times. Anticipate whether they are likely to find any of it distressing, and if so, be considerate when sharing it. So like if any of the news like breaking bad news, whatever is different. So if it can be distressing, you can reconsider stopping, not continuing, and tell them in different time or want someone with them to help them. So always just think about whether it can be distressing or not, this information to them, and accommodate a patient wishes if they would like to record the discussion. So this is really important in our station as well. We're going to ask them whether they want you to record the discussion or not. Accommodate the patient wishes if they would like anyone else, a relative, partner, friend, carer, to be involved in the discussions and or to help them in making the decision. So we told earlier, it's really important to have a family member. So also in this station, we will ask the patient if you want anyone to be present with you during this consultation or not, or if you want me to get your next of kin, whoever, to be involved in your management plan and to help you remember your medication. For example, he has some concern regarding remembering. I will tell you about the station. And use interpreter or translator if needed, if the patient can't speak English. Share it in a format they prefer, written, audio, translated pictures, or other. So in the end of the station, like in our Black 2 station, ask them, would you like me to send you a recording or a letters about our consultation to help you remember it? Give them time and opportunity to consider it before making decisions. So here it doesn't apply to this BLAB 2 station. So regarding our station, so I'm going to talk about the diabetes review because it's coming the most. We have diabetes review warfarin. Just on discharge, you need to explain warfarin to the patient, which is easier. And we have diabetes review, and the other one is not really typical one. So just the mother can't hear well or can't understand well. So just you need to speak slowly with her and ask her if she need you to speak louder or she slowly. So she seems to be has some problem to understand you, the autism mother. But it's not in all autism station. I have autism station. She was very fine speaking normally, but recently they tried to make some changes, but they may bring the mother speaking to you normally. That's fine. But if she told you many times, I can't hear you, doctors, can you please speak slowly, whatever. So just ask her, like, is there anything you want me to do for you to make you hear me better or anything like this? So you'll find out what's wrong with her. So BLAB 2 station. So we said we need to speak about this diabetes review. So first, as I said, build a rapport and make them comfortable with you. For example, after introducing yourself, say thank you so much for coming today, and I really appreciate because your visit to us today, because this is really very important review for you to make sure your diabetes is controlled, and just something like this. And so I also told you, like, every time you say how can I help you, whenever the patient tell you, try to do the IPS part. So so when you ask him here, how can I help you, he will tell you, I came here for my diabetes review. So just thank you him, embrace him at this point and offer support. And okay, so you thank you him, you brace him, you offer support. Now it's to know about the difficulty, and it's very tricky because if like you ask directly about the difficulty, I don't know, but some people, they might accept, like if you ask them, you told them like this, from my note I can see that you have some learning difficulty, do you mind to tell me about it, just to be able to make this consultation better for you. So it will be absolutely fine. But if the patient, for this station, I think is fine, like the diabetes review patient, it's fine to ask him because he has very mild disability. So he can communicate with you easily. So it's very normal to ask him like this, because it's a must to know what's the difficulty they have before we start the station. Otherwise, whatever we saying, they may not hear it, they may not understand it. So how you could run the consultation without knowing the difficulty? So the first thing, just ask him in specifically this station, diabetes review. So ask him from my notes, I can see that you have some learning difficulty. I would be grateful if you can tell me more about it, so to have a better understanding of your situations, and I see what I can do for you to make these consultations as effective as it should be, for example. So for example, if so in this diabetes review, he said he just doesn't understand when you speak too fast. He wants you to speak slowly, and also he has some memory issues. So just he finds it difficult to remember things. This is only thing he said the problem he has. But whatever, they may change it slightly, a little bit. They tell you, I have, for example, hearing difficulty, or whatever. Just ask open question. Can you tell me more? And what would you prefer me to do for you? So just ask him how you can talk to him to make him understand you better. So now your job is finished. He will tell you whatever, address his concern, and thank you him for sharing this information. Thank you so much for sharing this information with me. I will do my best to speak slowly. If he told you, just can you speak slowly? I will speak slowly, but please let me know if at any point I spoke fast, or you are not able to follow me. So, and just apply the previous tips we said earlier, and apply tips we learned for teaching station teaching skills. So deal with him as you teaching medical students, like check understanding every sentence, like whatever any information you're telling him. For example, you need to take this insulin 3 times a day, once before lunch, once after dinner, whatever is written is a task for you. So just you need to say it exactly the same, and the paper will be in front of you. You can read it again inside the room, no problem. So just you told him this information, straight away ask him, can you please repeat what I have told you, just to make sure I made myself clear enough for you. So always when you ask, say to make sure I made myself clear enough. So the problem in you, not on him. Because if you ask someone, can you tell me, repeat what I told you, like you testing him if he can understand or not, it will be rude. But it's not about him, it's about you. Yes, you need to make sure you made yourself clear enough for him. Can you please just repeat or summarize what I have told you to make sure I have made myself clear enough for you? Okay, and just is that clear so far? Do you want me to repeat? Same like what we do in the teaching. And break them even for asking questions. This is very good questions. This is very valid concern. So always remember to praise them. Apply the skill you have learned to on communication skills. Yeah, so throughout the stations. Addressing, acknowledging the feelings, the concern, verbal, non-verbal cues. Always try to find out lots of things in the station. Is more important than your medical knowledge. So try to find these things, because they put for you at least 5 points that they check in your communication skills, and every time you miss one, they will drop your marks. And everyone does exam will be surprised why I get like 1 and 2 in my communication skills, because they tested you in many areas throughout the exams, and you was focusing in your medical knowledge. You are focusing on yourself, not on the patient. As the patient showed you many non-verbal cues, he showed his face, he showed, and they acting very well. They are true actors, like they hire true actors, so they can do facial expressions that showing whatever anger, embarrassment, whatever. So you need to keep eye contact and find out if there is any non-verbal cues and acknowledge it, because this is checking you here, and they will drop you down if you missed it. So always, since just the first word you saying to the last word you say to the patient, end of the station, you have to focus on this, because they're really looking out for you for this stuff. Cover the following point from, but it's still because they know we don't have this communication skills. Here they teach them these courses in the university. In our home back, no one teaches this stuff. So they understand. So they are not very strict in their marking in BLAB 2, because if they've been very strict with you, if they treat you the same way, they treat the medical student here, for example, my student at Queen Mary, they will give you 0 in all the stations. But they know that you are have different culture. You didn't learn about these things in the past. But anything from you, it will believe them. Like if you show them you are kind in different way, like just being very kind to the patient and laughing with them and being natural with the patient, and these things, they give you marks here and there and there. So they are not very strict in their marking, but still you need to make effort. Okay, so we need to cover the following point in our station from NICE guidelines. Investigations. So we will tell him, like we'll gather data like any normal station about he had DKA 2 weeks ago. So you will ask him about, can you tell me what happened in the hospital? And like, because he diagnosed, I think 2 weeks ago when he has DKA, and he had a nurse, district nurse, followed him at home after discharge, but she found his blood glucose still not controlled. And now he came to the GB for review. So this is the story. So you will collect all the data from him and ask him about symptoms of diabetes, complication of diabetes, and we'll tell him about examinations. And when you get the investigation, you will do routine investigation and check his blood glucose and monitor him regularly by hemoglobin A1C to see long-term checkup or monitoring. And in the management, you need to discuss with him the insulin. So he was given insulin 3 times a day, and it's written in the script, in the task, like what type of, like he has 1 short acting and 2 long acting. So it's already written in the task for you, and the dose, everything written. Just you need to tell him about this. And you need to ask him about the insulin injection, like if he's able to inject or not. So he had district nurse after discharge. So she taught him about insulin injection. Just ask him if the district nurse taught you about insulin, and if you find any difficulties to inject the insulin. If you need extra help, please let me know. I will send the nurse again for you. So simple as this. But he already has a district nurse too. She did this with him, but just double check with him if he's still happy, if he's happy with his insulin injections. And also you can explain about hypoglycemia symptoms and treatment, and tell him we will do regular follow-up to see if you like risk factor for cardiovascular disease, like cholesterol, diabetes, hypertension. And you can also, in the past medical history, ask him about the smoking and alcohol. And also tell him I will send you to the eye. You need to have regular eye checkup, and you have in the examination, tell him I'm going to examine your foot and nerves. So to check for complication of diabetes, and that's it.